Well, y'all, thank you for coming. As you know, this is an initiative by the Trump administration to go to places to help with the testing and also to deliver information and receive ideas from the states. And we're highly delighted to have Surgeon General Admiral Jerome Adams with us today, as well as other people whom you recognize. And we'll hear from him and then from Director Brandon Traxler of DHEC, and then we'll stand for your questions. Admiral?
Well, good afternoon, everyone. Really great to be here today in the great state of South Carolina. I want to say thank you to the governor and also to the president of the University of South Carolina for a wonderful roundtable we just had talking about what's working well, what challenges still remain, and the progress that we are making as a nation and as the state of South Carolina in our fight against COVID-19. And make no mistake about it, there has been tremendous progress both nationally and here in the state. As the governor says, and I couldn't say it any better than what he did, we may not be able to eliminate the virus, but we need to appreciate that we understand the virus so much more than what we did back in March and April. And that has resulted in a decrease in mortality. Fewer people are dying when they get diagnosed with this virus. A decrease in length of stay in hospitals. We now have surpassed over 100 million tests. The president just talked about this, and so more cases are being diagnosed. And we are slowing spread of this disease with what I call my 3 W's. Number 1, washing your hands frequently and thoroughly. Number 2, watching your distance, meaning staying 6 feet from others and maintaining consciousness about whether or not you're going to be in crowded indoor spaces. And then number 3, wearing a mask. Important for everyone to know that these 3 simple health measures really are all we need to drive this virus down and to be able to reopen more places and to keep them open. How do we know this? New York, worst in the world, and now has a less than 1% positivity rate, and they're reopening schools, and they are opening more places up because they've adhered to these measures. Arizona, one of the worst places in the country just a few months ago, now one of the best in the country, and they did it without having to completely shut down, but they did it because they had the cooperation of the people. And so the main thing I want to say is thank you. Thank you to all the people of this state who sacrificed, who've worked hard, because it's paid dividends. Remember back in March and April, there were predictions of well over 1 million deaths in this country. And we tragically are around 200,000 deaths, but that's many fewer than could have occurred and would have occurred if you all hadn't done your part. It's important that you understand the actions that you're taking to protect people truly are saving lives, and they're allowing us to reopen. I want to thank the college students out there who are doing the right thing, and all the people on the campus of the University of South Carolina for their efforts. And we just had a great conversation with Mayor Benjamin. This can't happen without partnerships at the state level, the local level, with businesses, with churches, with schools, and with the local universities, and with the National Guard who's here helping us set up this site today. So I just want to finish with one last thing before I turn it over to Dr. Traxler. I want people to understand this is going to be perhaps the most important flu season of our lifetimes. It is critically important that we not have a bad flu season on top of a bad COVID season, because it could overwhelm our healthcare systems, and it will also confuse our ability to be able to screen for COVID. Here's what I mean. Many places that you're going into now do a symptom check, or they do a temperature check. And if you screen positive, they're not going to let you in. And if you have severe symptoms, they may have to contact trace everyone you've been in contact with and shut down that institution. Well, if you're coming in with flu that could have been prevented by taking a vaccine and you screen positive, then it's going to cause a lot of trouble for you and for the institutions you're trying to encounter. We can truly help our communities save ourselves and save others by getting a flu vaccine this year. Also important to get in the habit of doing the right things, because we know that people who get their flu vaccines are going to be more likely to get a COVID vaccine. And I want you to know that I will be among the first in line when I have an opportunity to get a COVID vaccine, because I know it will be safe, I know it will be effective. We have the safest vaccines in the world, and the safest vaccines in history, and that's because of the process we go through. A process where independent people have to look at the data. It isn't determined by the government whether or not these vaccines have the opportunity to ultimately take that first step towards approval. It's an independent data safety monitoring board that looks at the data and says it is safe and effective before it even gets to the FDA. So I want you to understand the importance of vaccinations, whether it's for measles, mumps, and rubella, or for the flu, or for COVID-19. We're in the midst of a major social justice movement in this country. And I want people to understand that thousands of black and brown people die every year as a result of the flu. And we have a vaccine. We can prevent them from dying. So if you care about social justice, understand that we can't have social justice unless we have health equity. And one of the quickest, easiest, cheapest ways for us to move towards health equity is to make sure as many people as possible are getting their flu vaccinations, are catching up on their childhood vaccinations, and getting the COVID vaccine when it comes out. With that, I just want to say one more thing about mental health. It's a challenging time. Anxiety's up, depression's up. Unfortunately, opioid overdoses are up because people are self-medicating some of these mental health problems they're having. And I want you to know it's okay not to be okay. We expect people to have anxiety and depression, particularly at a time like this. What is not okay is watching someone else around you suffer and not helping them get the help that they need. So if you need to talk to someone, you can call the national helpline, 1-800-662-HELP. There are people available 24 hours a day, 7 days a week, and they can get you the help you need, even if you just want to talk to someone. Because the last thing we would want is for you to survive COVID, but to ultimately have problems because of the stigma attached to seeking help for mental health, or because you didn't know that services were available. With that, I'll turn it over to Dr. Traxler, and she'll give you an update from the state perspective, and then we'll be happy to ask questions. But wear your mask, wash your hands, watch your distance, get your flu shot. If we do those things, we'll get this virus under control. You'll see more places open. You'll have more freedom. Thank you.
Thank you, Surgeon General. Governor McMaster, and with that, I also am going to remind everyone, I think you've gotten the photos you need to social distance, even as we stand back here, even outdoors. It's so important, as the Surgeon General was saying. We're so grateful that the Surgeon General Adams has continued to come to South Carolina. He was here previously, and we appreciate his collaborative work to increase access to testing. I want to thank the U.S. Department of Health and Human Services, Governor McMaster, the National Guard, and General McCarty, University of South Carolina, President Caslin, and the City of Columbia and Mayor Benjamin, and all the people that are working at this testing event and behind the scenes. See, I get so used to wearing my mask, I don't even think to take it off. They are all integral to having these testing events be made possible. This year, we, both as a nation and as a state, have been faced with what may seem like insurmountable challenges. However, as a native South Carolinian, I take great pride in knowing that our state's public health professionals, essential workers, and community partners continue to remain steadfast in our commitment to protecting the health and safety of every South Carolinian. It's because of these people's tireless commitment and dedication, as well as the support of many others across the state, that South Carolina can be hopeful that we will bring this virus under control. I am confident that we will. But to do so, we must stay the course by following those measures and guidances that have been working for us. That includes continuing to wear your mask and maintain the Maintain the current guidelines that the governor has set in place to help stop the spread of the virus, such as our restaurant and bars. Thanks to these concerted efforts, we have seen a decrease in cases in the state since the governor's orders were implemented. I urge everyone, though, to continue to follow these guidelines and recommendations, including mask wearing. We are seeing them be successful, but that does not mean it is time to stop doing them. Rather, if we want to return to a sense of normalcy or a new normal after this pandemic is over, we must act more aggressively now than we ever have before, and we must act now. Testing is a critical component of that effort. As of today, South Carolina has performed over 1.2 million tests, and there are nearly 600 testing opportunities scheduled statewide, including 359 mobile testing events scheduled between now and the end of October, and 236 permanent COVID-19 testing facilities in the state. In addition to working with our partners to hold these large-scale testing events, like today's surge testing event here, we are continuing to look at ways to increase testing and access to it across the state. This includes ensuring that every county in the state has at least one no-cost community-based testing event per week, and the larger counties will even have 2 or 3 events per week. We're providing testing daily in the large metropolitan areas, and we're increasing the average number of testing opportunities from just under 8 events a day to over 12 events a day now statewide, and that continues to increase. To ensure South Carolina has the capacity to increase these testing efforts, we've contracted with 4 additional labs, bringing our total lab capacity to 8,800 specimens a day. And as part of the agreed upon contracts with these labs, each contractor must process the specimens and provide results within 48 hours of receipt of the specimen. Our own public health lab continues to maintain a 24 to 48 hour turnaround time with specimens. We also recently began a Kershaw County School District staff surveillance testing pilot. This project will provide weekly testing of over 1,600 teachers and staff throughout the school district. And it'll provide not only information about the incidence rate among K-12 teachers and staff, but because of the Kershaw County School District format for virtual teachers, it will also allow for comparisons between the incidence rates in teachers who are involved in face-to-face instruction and those who are teaching solely virtually. To further expand our efforts, DHEC, in collaboration with our partners, is looking at all the tools that may be available at our disposal. That includes saliva testing, which has been spearheaded in the state by the University of South Carolina. We recognize that saliva testing shows great promise as being another flexible tool that we could use to support these testing efforts in response to the virus. In addition to this great work currently being done by the University of South Carolina, DHEC's Public Health Lab has applied to use the Yale Emergency Use Authorized Protocol for saliva testing. And our folks just received word back yesterday from the Yale School of Public Health, and we're in the process of acquiring the necessary supplies to begin the self-validation process. And at the same time, we recognize that holding more testing events will not be enough to achieve our ambitious testing goals. It will take all of us to move the needle on testing in South Carolina and ultimately stop the spread of this disease. We encourage anyone who needs to be tested or who wants to know their status to get tested, either here over the next couple of weeks at these surge testing event sites or at another testing site in the state. People attending community testing events like the one that we're kicking off today is pivotal to helping us identify where the virus is and quickly take action to reduce its spread. We understand that this has been a long journey and that we still have a ways to go, but we are optimistic. Together we can get through this, and South Carolina will be stronger and better for it, but we must act now. This includes continuing to take those actions that we know that are shown to be working to cut the transmission of the disease. That includes wearing your mask, doing that at least 6 feet of social distancing, frequently washing your hands, and getting tested to know your status, especially if you're around other people a lot. Together, we can completely reverse our fortunes. We can create a safe environment for our children and students and teachers, our neighbors, and our business community. So for more information, if you want to be tested on sites, go to scdhec.gov/COVID-19 testing. You can filter by location, type of event, and find the best testing event for you. So thank you again to Surgeon General Adams, Governor McMaster, and all of the partners involved in this event. With that, I'll turn it back over to Governor McMaster.
I'm going to jump in really quickly. Put your mask on and stay up here with me.
Yes,
so,
sir.
Tell the people the website again.
It's scdhec.gov/COVID-19 testing.
And it's testing free.
It is at many of our sites, at all of the DHEC sites statewide. It is no cost, and you can even filter by that on that webpage.
And how quickly will it take me to get my results in most cases?
Usually 24 to 48 hours.
Does it hurt?
It does not hurt.
So I want to demonstrate to folks what's going to happen if you come to one of these sites. I know a lot of people are concerned about whether or not a test hurts. Actually, we now do what is called a Nares test, which is different than the traditional nasopharyngeal test. So what you'll do is you'll come, they'll hand you a bag.
You want to hold your bag?
Well, I can hold on to it because I don't want to contaminate you. And they'll have you open up the specimen container. They'll also give you a swab. And you can take the swab out. You just put it in the tip of your nostril and turn it around 5 times. Put it in the other nostril. Turn it around 5 times. It doesn't go all the way back, just in the tip. Doesn't hurt at all. As a matter of fact, it tickles a little bit. Then you put it in the container, break it off, put the top on. That's how easy it is to get tested. We want everyone to know testing is easy. It's available. It's never been more available. And we need all of you to do your part. If you don't get tested, then the Department of Health and all the other partners out here can't understand what the disease is doing, can't isolate people, can't contact trace, can't contain this virus. So part of doing your part, again, is making sure you get tested, especially if you have symptoms. But even if you just want to know your status, you can come in, correct, and get tested.
Absolutely. You do not have to have symptoms at our sites.
Great. Thank you for clarifying that. And now we'll turn it back over to Governor McMaster. I should have tested you. I should have done.
I've already been tested 5 times, 3 times by Dr. Track.
And I was just tested and tested negative yesterday.
I'd like to ask President Castlin to remarks.
Thank you very much, Governor. I appreciate it. It's an honor to be here. First of all, to Surgeon General Dr. Jerome Adams, sir, thank you very much for being here with us, to come all the way down here to our community. Thank you for bringing the surge testing down here with us. I think this testing right here is a great opportunity for the entire community, those of us that are part of that community from the university, to be able to participate in this surge testing. Testing is so important. It just sends the right message to our students and to our faculty and staff, to the entire community that we care. This is tremendously important. And I believe testing also has the ability, as an aside, to help modify behavior. The last thing I want to do is to go get a negative test, so I'm going to make sure I'm going to do everything I can to protect myself, and while protecting myself, I'm going to be protecting others. Governor, sir, thank you very much for your leadership and your partnership with the university as we work with our students, bringing them back on the campus and creating a safe and healthy environment on the campus and within the community. I know the mayor's not here, but I do want to comment on the mayor's great partnership with us, with the ordinance that he's put in place that are so necessary, I think, to really take care of some of the high-risk areas, the social activities off campus, and he has been fantastic. So Mayor Benjamin, thank you so much. To Director Taylor and Dr. Traxler, thank you very much for your leadership and your partnership with DHEC. We could not be able to, in our university, make the tremendous progress that we have to create the safe and healthy environments that we have without your partnership, so I just want to say thanks. And finally, Mr. Surgeon General, we're really glad that we are now partnering with you. Ambassador Burks was here last week and had a tremendous visit with us, and we were able to showcase some of what the University of South Carolina is doing with the resources that we have, principally with our doctors and our scientists and our epidemiologists from the Arnold School of Public Health, and then from our School of Pharmacy that has put together the saliva test. one of very few universities in the entire nation that has that capacity. But it gives us the opportunity to test and to test and to test, and it's our intent to test as aggressively and as much as we can, because it really, like I said, sends the right message that we really care. But I just want to say thank you very much for having us here. Surgeon General, Admiral, thank you very much for taking the time out of your busy schedule to come all the way down here to South Carolina to visit our campus. And DHECS, ladies and gentlemen, thank you very much for your partnership as well. Thank you.
Thank you, Mr. President. Are there any questions? We've got answers.
I've got a question for the media. How many of you all have been tested? Raise your hand if you've been tested. How many of you have been tested in the last week? All right, so those of you who don't have your hands up from the media, we've got a testing site right over here. Testing's free. I'm 100% serious. We need you all to go over before you leave today, sign up, get tested, so that when you're writing your stories, people understand how safe, how easy, how quick it is. We want to make sure we are utilizing the testing that the governor has worked to bring here for the people of South Carolina. We want to make sure we've got as many people tested as possible with the resources that have been brought here, and we need you all to lead by example. Get your flu shot, get tested. It's what you can do to protect your community.
I bet you didn't expect that, did you? Are there any questions? Yes, sir.
How many people are you anticipating or hoping to get tested through this surge over the next 2 weeks? Is there a number? Or?
Our federal partners, from what I understand, have the capacity to test 5,000 people a day over the next couple of weeks. So capacity should not be an issue. I encourage everyone to come on down and get tested.
And those numbers will be rolled into the daily reports that DHEC releases?
Correct. They will be giving us these results, both positive and negatives, and they'll be included in our daily reports.
I was in Hawaii about a month ago, and we opened up a surge testing site like this. When we come, we usually give the resources in partnership with the state to test about 5,000 people per day. Hawaii took on the challenge. They've got fewer residents than the state of South Carolina, and they got closer than any other state to using all 5,000 tests per day for that 2-week time frame. So I'm issuing the challenge, South Carolina. Come on out and get tested. It's free, it's easy, it's available, and again, it's a great way to make sure you can protect your family and your community.
And this is the first federally backed surge site in South Carolina that we're at right now?
In terms of available to the public and the community and this large, absolutely, yes.
Question? Okay. Well, again, Admiral, we appreciate you being here and all the others, and we're making great progress in South Carolina. We want to do our part, so we urge you, now's the time. It's free, it doesn't hurt, and everybody here is invited to go over there and get tested. Thank you.